So let's talk about co-infections. So what are co-infections? Who are they, and what kind of conditions do they result in, and how are they treated? So one of the things I think that's important to realize is that with Lyme disease, quite often the tick or the insect that bites you that transmits the Lyme disease, or potentially not the Lyme disease and some other bug, can also contain one or more co-infections. And it's not uncommon for when we actually test individuals or ticks for them to kind of have one or two or three extra kind of pathogens or parasites within them that was also transmitted by the tick at the same time. And so the most common ones that we would see other than Lyme disease is anaplasma or ehrlichiosis, and the symptoms that you typically would see is very similar to Lyme disease. So you typically have less fatigue, but you would have a lot of joint pain. And that joint pain will be kind of wandering around the body, right? It'll be sometimes in one knee, sometimes in one shoulder, and then all of a sudden the other knee. And then, it'll kind of wander around the body, but it's generally kind of focused on joint pain. It's not to say there couldn't be other symptoms, but that's the main one with that bug. Now, Bartonella, which is interesting, that one was actually the common name back during World War One was called trench fever, because this is, or more commonly known nowadays as cat scratch disease. It can be transmitted from cats, and we're just talking about normal house cats. It doesn't have to be wild feral cats. And things like sand fleas, or just fleas in general off of any kind of mammal. Um, and so it's possible for you to not have a tick bite, but you had to have symptoms similar to Lyme disease. And one of them is Bartonella. Now, Bartonella in individuals sometimes and not always will have this kind of almost like stretch marks on the back. So it'll be these kind of horizontal lines, usually a bit more red in nature, almost looking like a bit of a scar, but more of an indented scar, not sticking out, more kind of in. And I call it kind of like tiger stripes, where you'll see these horizontal stripes on the back. And some of them can be subtle depending on what your skin tone is. But for the most part, you'll see that in a fair amount of the individuals that have Bartonella, not all of them. Now, what are some of the symptoms that you would get with Bartonella? Now, Bartonella is typically more neurological symptoms. So this would be brain, nervous system, eyes, ears, like anything kind of related to brain communication within the body. So you can get weird kind of facial tics. You can get, your eyebrow twitching as you're trying to fall asleep at night. And we're talking about like on a regular basis, not just once in a while. Weird sensations. So my patients will often um, say stuff like, I feel like there's water dripping down my leg, or it feels like something's crawling underneath my skin in my forearm here. Those are very, very kind of characteristic symptoms. And in some individuals, because it does burrow into brain tissue, right, you can get vision issues, you can get hearing issues, but more importantly, you can get a lot of mood stuff. So severe depression, severe anxiety, borderline personality disorder, schizophrenia, these type of diagnoses I've seen in a lot of my Bartonella patients, which is very scary. And so it's important that you have that information and that you're also tested for it if you start to see any of those symptoms. Now, Babesia is another co-infection that we see. It's a little less common, at least in my area of the world, but I have seen it. And it is very much like malaria. So it has a lot of similar characteristics. It's a very similar bug. The main symptoms that you would see with that one is typically a temperature regulation issue. So people that are very, very hot, almost feverish, and then they're very, very cold, and then they're feverish, and then they're cold. And so really having a hard time with temperature regulation. The other thing is it's less common, but it is a characteristic symptom is something called air hunger, meaning like people feel like they just can't get in enough air to breathe, even though they're breathing normally. It just feels like someone's almost like sitting on their chest. And so that's really, really important, those symptoms to kind of look for. I mean, obviously, things like fatigue is pretty pervasive across. And with some of the co-infections we talked about, they can even have gastrointestinal symptoms. So, like almost an IBS that comes out of nowhere, or irritable bowel syndrome, or bowel movement issues is very common with these as well, because the bowels are controlled by your nerves, and you can have parasites living in the bowel tissue as well that'll cause irritation and inflammation. Things like rickettsia, Rocky Mountain spotted fever, you'll see things like fevers again. You'll see migraines. You'll see all kinds of kind of head kind of centered issues with that one. Sometimes skin rashes as well, you'll see with those. And then there's the whole kind of concept of co-infections with that are viruses. So things that aren't necessarily transmitted. Now, mind you, there are some viruses that could be transmitted, like Powassan virus, that can cause severe cardiovascular issues and even death. That is a possibility. But a lot of the viruses that I'm going to be talking about are typically ones that we're exposed to as children and that they kind of are harbored within us. So a lot of us are familiar with like cold sores, people to get these little lesions on their lips. And so that is essentially a herpes virus. Well, most of us don't realize that, there's more than one herpes virus. So we know there's genital herpes and then there's the cold sore herpes, very similar, herpes simplex 1 and 2. But they typically show up in different areas and they live within us and they pop out whenever we get run down or sick or we go through a major trauma like a divorce or a death in the family. And so there's those ones, but there's other ones like Epstein-Barr virus, cytomegalovirus, Coxsackie virus. There's HHV6, that's herpes 6 and herpes 8. And all of these have the potential to kind of come out of hiding and erupt when our immune system gets attacked by some of these bacterial infections. And so these are things that we need to talk about as well and also test for, because antibiotics will not put those bacteria back, or the viruses back in the box. You're never going to get rid of those herpes viruses, or at least not with the technology and the pharmaceuticals that we have now. But you can kind of suppress it to the point where the body can kind of control it again. So let's talk about some of these kind of co-infections that I will call them, that aren't truly kind of passed on by the bug. So Epstein-Barr virus, this is the first one. Epstein-Barr virus is otherwise known as kind of kissing disease or mono. And this is something we typically get as young adults. You're really tired for about a month, or maybe not even that long. Go home, get rest, drink fluids. That's the treatment. It usually doesn't come back or erupt in individuals. Now, when it does come back, instead of it kind of having an affinity for the liver, because usually when people have mono, their spleen or their liver will swell up. Sometimes that'll happen when it comes back. And you'll see elevated liver enzymes or elevated markers related to the spleen or the pancreas. But most times, what you'll see is with Epstein-Barr coming back, it'll affect the thyroid gland. And the thyroid gland's involved with weight regulation and energy production. And so all of a sudden, you can see the onset of something like Hashimoto's or Graves' disease or some other kind of hypothyroid or hyperthyroid type condition. And so that's really important. If you see a lot of thyroid issues kind of popping up out of nowhere, there's a very good chance that there could be kind of an underlying viral infection like herpes, um, and Epstein-Barr virus more specifically. I mean, if we're going to talk about thyroid just quickly, I mean, the other thing you're going to want to screen for is environmental toxins, because we know those have an impact on thyroid disorders as well. But that's a whole nother talk that we'll do in the future, is on mold and heavy metals and man-made chemicals and its impact on kind of the Lyme disease patient and their inability to recover from Lyme disease if we're having a hard time treating it. Anyways, back to Epstein-Barr. So the thyroid's typically more involved. Chronic fatigue, fibromyalgia, those are the symptoms that we typically see, or people being diagnosed with that have what we call chronic mono. Now, the other virus that can pop out of nowhere or from within is cytomegalovirus. Now, cytomegalovirus typically has more of an itis. So, any diagnosis that has an itis, so retinitis, pneumonitis, meningitis, any itis means inflammation. And that's what we see. We see inflammation of nerve and brain tissue. So, eye problems, ear problems, brain problems, weird sensations throughout the body, headaches, splitting migraine headaches. And there are some studies to show that cytomegalovirus has an impact on the potential onset of diabetes as well, because it can impact the pancreas. And so that's why it's really important to test for cytomegalovirus, but very much a neurological type a feeling or a symptom picture that you'll see with cytomegalovirus. With Coxsackie virus, it's a weird kind of combo. So Coxsackie virus is hand, foot, and mouth disease. So a lot of us have heard of that. A lot of our kids or people we know have gotten hand, foot, and mouth disease, and oh yeah, they're better from it. It won't come back. but it can come back. And when it does come back, what you'll see is this combination almost between Epstein-Barr virus and cytomegalovirus. So some neurological problems, headaches. We can see a lot of fatigue issues. We can see pain issues with these patients, and we can see elevations of liver enzymes, and we can see all kinds of inflammatory kind of processes within the body that have unexplained origins. And so Coxsackie virus is very, very important to test for when we're thinking about some of these other kind of co-infections. And I say that again lightly, knowing what we talked about earlier, that quite often they're just still harbored within the body and erupting out when the immune system gets weak. And so those are the ones that I tend to focus on the most, or the ones that I see most commonly are the Epstein-Barr virus, cytomegalovirus, and Coxsackie virus. So to recap, I mean, we talked about Bartonella, we talked about ehrlichiosis, we talked about Babesia, we talked about rickettsia, Epstein-Barr virus, cytomegalovirus, Coxsackie virus. If your lab testing is not testing for all of those and you have severe symptoms that have persisted for a long period of time, you are doing yourself a disservice, because if you don't get the complete picture, then you're not going to be able to put together a proper protocol to heal from Lyme disease or some of these other kind of co-infections. So in a future interview, I guess, so what we'll do is, or a broadcast on YouTube here, we'll talk about some of the other complicating factors. So this will be like heavy metals, chemicals, mold, etc. And this is the thing that kind of clouds the whole clinical picture even more, because if you've got this burden of toxins, you're not going to be able to mount a proper immune response. And no matter how many antibiotics you take, you might not be able to kind of bring your body back into a healthy balance, because you just don't have an immune system that can help kind of regulate everything at the end. So if you like the information, click and subscribe on the channel. We'll have more videos coming out. Please like or leave comments for any future topics you'd like me to cover, and try to hang in there, get as much information as you can, and stay tuned for more information from the Lyme doctor, which is me, Dr. Jason Backwich.